Hi, my name is Bridget Contreras. I'll be doing a presentation on wound care. This is for the school Grand Canyon University. The class is Nursing Informatics. Our instructor is Dr. Matten Lee, and today is December 14th, 2025. What is wound care? It is the medical management of injury to the skin and sometimes deeper tissue that can involve specialized care for healing. Wound care is a subject I feel many nurses can benefit from. While there are usually wound care specialists available that can help with care, they are not always available for every patient admission at all hours of the night. Complex wounds can result in delay of care due to waiting for these specialists. Although these wound care specialists should always be consulted because complex wounds often require care by specialists, certified wound care nurses assess, treat, and create care plans for patients with complex wounds, ostomies, and incontinence conditions. Quote by Kreisman and Ertzmeyer in 2021. It would be helpful to have more immediate care when it comes to these wounds for the patient's sake. Due to factors such as aging population and increasing comorbidities like obesity and diabetes, the United States is currently witnessing a significant rise in the incidence of chronic wounds. Quote by Casada et al., year 2025. This means more and more patients coming into the hospital are arriving with wounds. With immediate care on wounds, we can increase healing time and decrease delay of care on wounds, leading to increased patient satisfaction. Having more nurses with knowledge of wound identification and care can and will help with this. Learning objectives are one, to understand why learning more about wound care and identifying the wound correctly is important and the benefits that it can have for patients. Two, identify the common mistakes nurses make in identifying wounds. Three, learn how to identify wounds properly using the provided technology to assist in identifying wounds. And four, apply the skills learned to assist patients with wound care and help decrease healing time with proper wound care from time of admission. Instructional methods would include AI, artificial intelligence. AI has significantly transformed the training and education of professional healthcare personnel, offering numerous benefits. AI in education includes intelligent tutoring systems, chatbots, robots, and automated assessment tools integrated into digitized material that can improve education. Alves et al., year 2024. AI can be used to analyze images of different types of wounds, help learners to identify them correctly, and choose the appropriate treatment. An in-camera application could even be created to assist staff and make things more efficient. Interactive e-learning modules can be created to cover different wound topics, especially the different stages of wounds. These modules can include quizzes and scenarios to test learners' understanding. Virtual patient simulations can either be used to teach the use of applications or even different wound scenarios. These simulations can provide realistic scenarios and immediate feedback. Resource and support will include experts. There are certified wound care nurses that can assist with proper identification of wounds and measures that need to be taken. Also, these experts can help with correct educational information. Educational material handouts. These materials can assist with giving other nurses a review on wound subject. Teaching areas, this will help to have an appropriate forum to educate our peers on proper wound identification. Timeline will include week 1, introduction to the subject, the purpose, and overview on it. Week 2, identify common mistakes with wound identification. Week 3, introduction to AI virtual reality wound care application. Week 4, training with AI virtual reality applications. Week 5, application in real life, applying to real life scenarios. And week 6, evaluation and feedback session. Recruitment will include emails, flyers, short presentations for day shift and night shift. These short presentations on wound topic can help to bolster word of mouth. Communication will be email reminders, flyers throughout the workplace. Charge nurse can assist in following up with signups with staff. Challenges, we may need to offer multiple days for training and learning to give as much staff the opportunity to be compliant with this new training. Have master users to be able to help others in any new applications. And additional staff necessary to assist either with the use of new applications or to allow others to train. Evaluation, we will determine how well these teachings have helped our staff on the wound subject by using pre and post tests to measure knowledge and feedback from staff. Thank you very much. That is my presentation.